To your Caribou Data Science channel. A big shout out to what do we got here? The 3 people watched this video yesterday. I appreciate every single one of you 3 people. Of course, as we always say here at the Caribou Data Science channel, 1 view equals 1 like. So I want to see, I need you to just really click on those like buttons today. Also, of course, very important, click on the subscribe button if you haven't done so already. And also, I'm going to say most important of all, click on the share button. Share this video to do on your Facebook and your Twitter account. You can also copy and paste the link to this video into an email or text message and share it with your friends and family that way, okay? So let's get on with the show here. As we also, the caveat of this, as always, is the same each day. We need to remind ourselves that according to the governor's office, back in February 2021, they had undercounted deaths by close to 4,000. Of course, interestingly enough, they didn't seem to have any problem. Uh, didn't seem to have any problem counting cases during the same time frame. Anyway, if you look here, of course, the governor's office response to this 4,000 undercounting was not to go back and change the numbers, but instead he simply decided to add the numbers for the 11th, 12th, and 13th onto on the missing numbers onto February 11th, 12th, and 13th, and that's what this number looks like here. Here's the trouble. This is where they were on average. Okay, this for the previous days. Look what they do when they add these numbers on here. Okay, and this is what it looks like. So what we did, I replaced those numbers with an average number of deaths for those 3 days, and that's what this looks like here. So this is much closer than this here. Okay. This is what the raw data looks like. You can see here, this is that fourth quarter, which has been undercounted by 4,000. And this over here could be those February numbers, okay? With a little bit, 17 outliers. What do we got here? A minimum count of 5,098. An average number of cases per day, 31. The median, 19. The max is 752, okay? Now, this red line represents a 7-day moving average for deaths in Ohio. The blue lines, of course, is a linear regression line. You can see since December 1st, the deaths have been declining in Ohio, okay? This is the raw data for daily cases. Some summary statistics. And now here again, the red lines is 70-moving average. This is a bit of a concern. Well, I wouldn't say a big concern, but it's a bit of a concern. That's that sometime back around here by mid-July, cases started to increase again. But there's one thing we have to keep in mind here, okay? That's that the COVID-19 vaccine doesn't keep you from getting COVID-19. It reduces the chances that you will die from it once you catch it. So this, even though cases can remain deaths can be relatively low or even decline, this number here could go up. And of course, this is a number that the media wants you to think about. Okay, this is a number. This is a number that in hospital beds is really what the media wants you to focus on. But I will remind you something of Washington University Institute of Health Metrics and Evaluation says on their COVID-19 site. The single best measure of the spread of a pandemic is daily deaths, not cases and not hospital beds. Okay, the daily deaths. But anyway, Buckeye Nation, this does conclude your report for today. Hey, don't forget to click that subscribe button if you haven't done so already. Click that like button. Remember, 3 views equals 3 likes. Third and most important, don't forget to click on that share button. Share this video on your Facebook and your Twitter account today. You can also copy and paste the link to this video into an email or a text message and do it that way, okay? Thanks so much, Buckeye Nation. We'll catch you on Sunday with an updated report.